Hello, my name is Beatriz and I'm going to present the study named as Individual Management Practice and the Mental Health of Managers of Brazilian Public Universities. The study was conducted by me and by teacher Marina Greghi Sticca from University of São Paulo and by teacher Amalia Raquel Pérez-Nebra from University of Zaragoza. In the 90s, the implementation of neoliberal adjustment policies in Brazil took universities to intensification of work and precariousness of work conditions because of accumulation of activities, quantitative performance evaluation parameters, and the reduction of staff and continuous overload. In the universities, managers are generally professors that are appointed due to the academic community recognition of their professional career, but there's a lack of previous preparation for the development of managerial skills of these professionals that takes them to empirical management. The characteristics of managerial work in universities are some like accumulation of administrative and academic activities, long working hours, and lack of resources and funding for scientific work. And the lack of technical preparation plus the characteristics of managerial work in universities takes to negative impacts on managers' mental health. They have feelings of uneasiness and tiredness, lack of control, negative perception about work, and physical and psychological suffering. But the management practices can promote positive changes in times of crisis in organizations, and they refer to daily actions that are adopted at work and can minimize the impacts of this context to the mental health of workers. And managers at the level of their autonomy can make adjustments to their work through individual management practice that can be positive for this purpose. This study aimed to identify individual practices that are adopted by managers of Brazilian public universities in the management of their work that are perceived by them as positive to mitigate the impacts of the work on their mental health. This was a qualitative and exploratory study that counted on the participation of 20 managers of Brazilian public universities that responded to individual and remote semi-structured interviews with subjects like main activities, impact for mental health, and practice adopted by the managers. The results were analyzed into content analyzed and organized into categories. 5 categories were identified. The category communication showed the practice maintain transparent dialogue and communication with the team and make necessary corrections. The category social support showed the practice share the demands to solve them with peers and team. Planning showed the practice work as established in the agenda. Technical practice showed the practice direct to work accordingly to legality. And the category work organization takes to the practice delegate activities. The study shows that simple and daily management practices are positively perceived for mental health at work, and that social support corroborates with previous studies in this study too, taking to less levels of stress, and so being positive to mental health at work. The categories identified reinforce the contributions of the redesign of work to mental health because of the basic psychological needs they involve, as autonomy, relationship, and competence, and because of this redesign of work should be encouraged in the university because its contributions both to mental health and work engagement. Managers' difficult and suffering at work are also related to the lack of training received before assuming management position, and the study also shows that better mental health of the manager can takes to better mental health of the team because of direct relationship they have, and so it generates positive reflections also to the universities in terms of productivity. The study concludes that individual management practices applicable on the level of managers' autonomy are positive for their own mental health, and so encouraging the adoption of this practice that can contribute both at individual level to the organization of managers' work and at team level too, to the support they can give to employees' management of their own demands because of the control and autonomy the managers have on the work and team that allows adjustment to be made in the work of the team they have. And that it's necessary to offer educational actions to minimize gaps related to managerial and emotional competences. Study has some limitations predominantly associated with its sample that are from universities in the southeastern region of Brazil, where there's more resources available for work compared to other regions of Brazil. And it takes to difference in work condition in comparison to other regions. That takes to margin for possible biases in the participants' responses related to their perceptions about the demands at work and what it takes to negative impacts on mental health, and also to the types and examples of practices that are adopted. For future research, we suggest that conducting research that reports the overall measurement of the effects of educational actions in the area of TD&E by Brazilian public universities can be good to managers in order to prevent illness and promote the mental health of them. It also can be offered at the organizational level, aiming the development of skills related to management, and at individual level, aiming the development of skills for managing stress, anxiety, and reducing burnout levels. So the references are these of the studies. And we finish here.